show you our preferred breakfast to get you started on the right foot every day. We do a bunch of label reading, which is really tricky for a lot of people. We talk about just sort of the right amount of exercise and how to set up your own exercise program. We talk about sleep, and we also talk about changing your stress response. Now, how do we know that this is the right diet for people? And the reason is that there's 7 billion people living on the planet. We know a lot about information about, how many kids people have, how many cavities their, children have. We know where they've lived and where they've moved to. We know a lot of information, as I'm sure you guys know. With even the internet now, we feel like we're being watched. Well, we know a lot, and we know that, our country is pretty sick. I don't think I need to tell you guys that we're pretty sick in this country. And there's lots of areas in the world that actually don't have the same degenerative diseases that we do, and certainly not at the rates that we do. And when we look at it, we look at the reasons why. It's because of their diet and lifestyle. And Dr. T. Colin Campbell, who was in the Forks Over Knives trailer, he's done a lot of research on the subject. And he actually has put together the largest research project on diet and lifestyle that exists. But early on in his days, he was at Cornell, and he conducted some experiments on rats. He gave these rats aflatoxin, which is a known carcinogen, which means it causes cancer. And then he fed these rats with varying degrees of animal protein, and he actually fed them with organic dairy protein. So some of the rats he fed with 5% animal protein, and the other rats he fed with 20% animal protein. And guess what happened? None of the rats on 5% animal protein got cancer, or these precancerous lesions, and all of the rats on the 20% animal protein got cancer. And just to put it in perspective, 20% animal protein is not at all far off from what we see in this country. It's about 15 to 16% animal protein, but certainly some of the diets that are paleo or Atkins, they are way, way higher than 20%. So it's pretty typical for what we see in this country. Now, the really cool part is that when he took these same rats that were on the 20% animal protein and he ratcheted their animal protein down to 5%, guess what? The cancer started going down. It was reducing. And so he actually realized that you could turn on and off cancer. And it looked like this: 20% animal protein, 5% animal protein, 20% animal protein, 5%. So in light of this, he realized a lot of things. And number one, that carcinogens like pesticides are not, they can instigate cancer, but what really promotes the cancer is the animal protein. And that's the important thing here. And by the way, when he did this with wheat protein or soy protein, he did not see this cancer promotion. So then he went on, he got his hands on the Cancer Atlas, which was also in Forks Over Knives. And that was commissioned in 1970s by the premier of China, who was dying of bladder cancer. And he hired this was in China. So he had 650,000 workers at the time go out to 800 million people. I mean, this is just unheard of. We don't even have this number of people in this country. And you would never sort of be able to get compliance on this. So this was back in China when sort of everybody was the same. There wasn't a lot of going in and out of the country. And 98% of the people were of this Han population. So genetically, they were all pretty much the same. And what he found looking at this cancer atlas was that there were some cancers that were more common than others, but the most important thing is that the rates of cancer in some places were several times higher, and several hundred times higher than in other places. And that's hugely significant to have that difference in rates, because for example, if you take somebody in Montana and you take somebody in Portland, Maine, you might only see a difference in 1 or 2 or 3-fold. So we're talking hundreds of different. So this is a perfect example of saying what's going on. This is a highly controlled environment. So he wanted to investigate after he saw this information, and it was over many, many years. It was the largest study on diet and lifestyle ever conducted. And it resulted in 94,000 correlations, 8,000 of which were statistically significant. What he did is he trained people to go in people's homes in China and to actually record everything they did and ate for 3 days. Okay, so there was no they weren't asking, there were no surveys that people had to fill out and try to remember what they had to eat. This was all down to, very, very specific. And then they brought the food samples. They even got food samples of everything, and everything was brought to the lab so that everything was very technically analyzed what these people were actually eating. And so they were able to establish the statistical significance between animal protein intake and cancer rates. And not only that, but they found that we're told that cholesterol rates are more linked to cholesterol intake and to saturated fat intake. What he found is actually it's the animal protein intake that's the biggest predictor of your cholesterol. And that this cholesterol is also going to be the biggest predictor of whether you get heart disease or cancer. So animal protein was really found to be the culprit in why there were these 300-time-fold in different cancer rates. These were very, very, very plant-based people in China. And they were eating very small amounts of animal protein. So even somebody eating a small amount of animal protein really was compared to somebody eating a very, 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 very small amount of protein who was seen to have less cancer. So then you might say, well, wait a second, if 98% of these people are genetically pure, there must be something very special about these people, and we're just not that special here in this country. We're genetically set up differently. Well, we know that that's not true, and there's a few reasons why. One of them is migration studies. So as I told you, we know what happens to people when they move. So if you take somebody that comes from a country where there's low rates of disease, and they move into a westernized country, within one generation, they have the same rates of disease as we see here already. So we know that's not true. So the difference is because they've adopted the diet and lifestyle of the country where they've moved to. And the other thing is we also know from studies with identical twins that the biggest determinants in their differences in health are from their lifestyle and diet choices. And that these doctors who treat patients with diet, they report that compliance on the diet is really the key to the success versus genetics. So if you feel like this is really good information, you feel like there's a lot more to learn, which I can tell you there is. We teach you 8 hours in our course versus you have probably listened to about 35 minutes here. We present you with a lot of tools with the Wellness Forum. And so we have the Wellness Forum 101 class, and we call it Science and Skills. And it's just taking this information to the next level to really empower you to make your own positive choices. You do get a curriculum book. If you sign up with me, you don't get DVDs because I am the DVD. And then we have a wide variety. We have a member site where you get workshops. I'll be doing cooking classes and conference calls with Dr. Pam Popper. We also have an executive chef. His name is Del. So he will talk about different ways to prepare all kinds of different plant foods, really good stuff. And then there's a members-only website with a bunch of information, including archived phone calls. There's ongoing support. You get 2 private coaching sessions from me. But if you're not ready for that, there's always just the newsletter, which you can sign up for. So we have Dr. Pam's newsletter once a week, and then she does a video newsletter twice a week with great information. So that's one way to just sort of stay in touch with us. And then the Wellness Forum actually has a foundation where we work on school lunches and children's health. There's a school, the Institute for Health Studies, which is accredited by the state of Ohio, and we train healthcare professionals. And then there's the Forum Public Policy, the Public Policy Institute, where we actually we do legislative advocacy around licensure and nutritional guidelines, things like that. So sign up today. Does anybody have any questions?
I wish I didn't go grocery shopping yesterday. I bought meat and milk and
And now you have to eat it.
So what
Just
would
seriously,
someone eat? What would someone eat for lunch? Because like at 10:30, I usually have a yogurt, and at noon, I usually have a sandwich with bread, ham and cheese, and vegetables. So what would be comparable substitutes to those?
Well, it's a pretty, complicated issue, which we spend a lot more time in the class, and we'll spend a couple hours actually on the issue. But yeah, we actually recommend eating 5 to 6 times a day. Starting off with a breakfast smoothie, and then mid-morning could be any sort of mini meal, whether it's could be a bean burrito, it could be some sort of casserole you've taken, leftover from last night. Pretty much anything that you can think of that you're used to eating now can be made, vegetarian or plant-based. So even a baked potato with salsa, that's like a very, basic idea. There's, lasagnas made with tofu, ricotta, casseroles, all kinds of different things. And then actually we have a cookbook, it's called the Big and Healthy Cookbook, and it has really, really, really basic beginner recipes in there. So,
That would be good.
yeah.
Is that cookbook available on the website? Wellness Forum?
Yes, you have to call, yes. Everything has to be ordered through the office, but yes.
Okay.
Yep. And eventually, hopefully, I'll be selling it if I get approved.
I'll wait till that.
Should I stop recording?
Well, unless there's any other questions, thank you all.
Yeah, thanks. Great.
Thank you.
Yeah, thank you.
Hope
I'd
you enjoyed it.
approve you.
Thank you.